ADCES just wrapped. It's the annual conference that brings diabetes care and education specialists into the same place to learn more about diabetes innovations and technology. And today, we are getting into the biggest takeaways. The event covered the evolution of diabetes education and where it needs to go next, how educators can harness AI so that they don't get replaced, and there were new pumps on the show floor, including Pivot, a pump that's never been seen before. Plus, major updates on a cure for type 1 diabetes. My guest said that we are closer than ever to a cure for type 1 diabetes. Welcome to the show. I'm Justin. I have type 1 diabetes, and hopefully soon I won't. I cover all things diabetes tech news and research on this page. We've also got a website, diabetech.info, where you can get the latest news and sign up for our newsletter with the link in the show notes. Joining me today are two incredible diabetes educators, including my own Mary Rose Deraco, as well as Meg Moreta, who is a registered dietitian. They're here to share insights on the mental health challenges people with diabetes face, including anxiety, depression, disordered eating, and obesity within the type 1 community, plus the latest advancements in tech and research. Diabetes education is so important. It's the reason that I feel so in control with my own diabetes. My hope is that today's episode opens your eyes to how critical this role is and the life-changing impact educators can have on people like us. Keep in mind that anything here on the show is not medical advice and is for educational purposes only. Always consult with a physician before making changes to your healthcare. Let's get into it. Mary Rose, Meg, welcome to the show.
Hi. Thanks for having us.
Of course, you were my two correspondents at ADCES, and I'm excited to have you here to tell me all about it. You were texting me through the show, giving me little updates. I was supposed to go, then I didn't go because I wasn't feeling well, and so we'll get the news out somehow. First of all, how is Phoenix this time of year?
It was so hot.
117.
Oh my goodness.
That's
crazy.
Very hot.
Very, very hot.
But a beautiful hotel and a great convention center and a lot of very motivated diabetes educators that really want to do the right thing for patients. So it was very inspiring.
Definitely. It was a lot of interesting topics, especially AI is a big one right now, and how we're going to use it in the future. And they basically said you either use it or you're losing it, like you're going to lose your job. So, but I think it could be really helpful.
Yeah.
What is it that makes this conference stand out to you? What makes it unique?
Well, I think what's unique is that it's, certified diabetes care and education specialists from all over the country. It's not a scientific, we definitely talk about science and research, but it's different from the American Diabetes Association, and that's doctors and scientists, and it's all about research. This is about how transforming research into practice for us to motivate, to educate, to support and inspire people with diabetes.
Yes.
And Meg and I deal mostly with type 1 diabetes, and those are the sessions that we were able to go to. There's a lot of medical device, a lot of motivational interviewing, a lot of counseling type things on nutrition and eating disorders, and DIY loops and different products and things like that we can use practically with patients.
Yeah. And all of us are either a registered dietitian, a registered nurse, or a pharmacist. That's typically that have the background of that, plus the certification of the diabetes educator.
Yeah, and there's some social workers and psychologists as well. So it's other allied health professionals besides doctors.
Yes.
Before we dive in, I want to get a general sense of your takeaways. What were your impressions from this year's event?
Yeah, so mine were AI is coming. We can use it. It's going to be amazing, but we have to manage it. It takes a human being to vet it. That it has hallucinations. It makes mistakes. It doesn't always apply to things. So we're going to manage AI, and AI is going to make us more efficient. The other big takeaways is all the companies are working on human factors. So they're bringing in scientists that really are considering how they can use the data to motivate the patient to change and to help educate the patient. So that's extremely exciting in the tech industry for you. And then I would just say, what was another highlight for you?
I just found like some of the sessions were just so interesting that, like I found like there's this one topic of obesity and type 1s that was something that was really like interesting, because like you never think of that type 1s are overweight, but Americans are about 40% overweight, obese, and then now type 1 are 38%. So they're almost like tied, which is really interesting. So you're kind of wondering like what has changed over these years. And, both Mary Rose and I have been in the diabetes world for almost 30 years. And I'm not, I'm kind of looking at like what's the bigger factors. And, I personally, I think it's food sources. That's what, since I'm a dietitian.
I go on and on about how important it is to have a diabetes educator, because you, Mary Rose, you were there for me right at diagnosis. And I think I am as good a carb counter and manager of my diabetes because of your guidance. But a lot of people don't have educators, have never even really tried to get an educator. And I know that access to an educator is not great either. But just explain to us, what is the importance of having an educator?
So I think an educator can help you cope with your disease. And there are so many ways to cope. There are 7 diabetes self-management behaviors, and we can help you with those 7 behaviors. I mean, some of them are nutrition and exercise and coping and medication, TAC, that kind of stuff, preventing complications. So the list goes on and on. So we're sort of your buddy that takes you kind of through the different phases of accepting and coping with your disease. Yeah. So I think, we function kind of like therapists. I'm a nurse. She's a dietitian. I function like a dietitian. Sometimes she functions like a nurse. Sometimes we're definitely psychologists. Mm-hmm. We didn't know that we were going to end up being psychologists, but we are. We can communicate with your physician for you to help sort of advocate for different medications or different treatments for you, different types of pumps. I think we're also your introduction person to insulin pumps, CGMs, technology, and we meet you where you're at. So sometimes people don't come to the educator because they think we're going to push our agenda. Right. But some of the different ways that we're, focusing on counseling patients is to meet them where they are at, inspire them according to their own goals, not our goals. Right. And to not always focus on the data and the numbers, and they're not a number, and they should not, their worth and their happiness should not be based on that number, but they should understand what it is and the implication it has on health outcomes, so.
And we kind of provide like a roadmap, like, so they can kind of see all the steps that they're going to be going through. And so I find, just for myself, when I know there's a plan that I can see how it's going to work out, I just find that it just helps you like relax a little bit and just know like, you're going to be taken care of, because people are going to take you through those steps to get to better self-management of your diabetes.
Yeah, people aren't ready to learn everything all at once. So it's really important to assess where they're at and how much they can handle in that one session, and remind them, you can just work on this one thing this time.
Right.
And then let's meet in 2 weeks, or I'm going to guide you through your first trip away. I'm going to guide you through your first baby. I'm going to be there every 2 weeks for you. And it's just such a reassuring feeling to know that you have an expert on your side to go through anything that you need to go through in life.
This episode is sponsored by Omnipod. As someone with T1D and with an incredibly active lifestyle, it's important for me not to get tied up, especially with tubes on my insulin pump. I love to go swimming, lift weights, and play kickball with friends. And with Omnipod 5, I never have to worry about tubes getting in the way. Plus, not having to disconnect helps me to stay in range during all of my favorite physical activities. That includes sexy time too. See if you're eligible for a 10-day trial by visiting omnipod.com/diabetic. On there, you'll see full safety and risk information and trial terms. That's omnipod.com/diabetic. There were some surprising statistics that you brought up to me before the call, which was only 7% of people with diabetes see a diabetes educator. Only 5% of Medicare recipients see one. And you also mentioned there are only 3 certified diabetes educators in LA, the city of LA.
That do pump
that
therapy.
are doing insulin pumps for the major healthcare systems. So not every doctor has a insulin pump nurse that does the settings and does the carb counting and all the things that I do with you, Justin. Most private endocrinologists don't have a person like me.
Yeah.
They might refer to the diabetes nurse expert at the hospital that's in their community. We live in a very big city and we have 3 big hospital systems, and there are about 3 of me in this one side of town. So yeah, and probably, I don't know how many dietitians that specialize in diabetes.
Yeah, that
maybe a handful.
Yeah, and that's a hard thing, because some people have come to me and said, like, oh, my last dietitian said I couldn't do this, this, and that, and I'm kind of just going, no, you can do all of those things, but we'll talk about how it's going to work for you. Everybody's different, so, but no, you can do anything basically. It's just, having a plan, how you're going to get through it, and making sure you're safe.
Now, you mentioned in our pre-interview that people with diabetes have a higher risk of depression, anxiety, and disorderly eating. And I know that you learned a lot about the why behind that, and also potential solutions for navigating that. So tell us, why are we at a higher risk for all of these things?
30 to 40% in research study of type 1s have eating disorders. That's much higher than the general population, of course. I think it was the way that we approached food with them, and the good and the bad foods. We're not to say good and bad foods anymore. We controlled portion sizes. We told kids way back in the 80s, when I was a new diabetes educator, they couldn't have cake on their birthdays. I mean, the minute you tell somebody they can't do something, they're going to obsess about it, and they're going to develop a compulsive overeating or undereating or punishing, shame-based relationship with food. And this is where, that topic of obesity and treatment of GLP-1s comes in.
Yes.
Where they're a little concerned that doctors are giving GLP-1s to fix eating disorders, but it doesn't.
No.
It controls appetite a little bit, but it doesn't get to the underlying root cause of the eating disorder. And I think obesity could be related, that the rise in obesity, it's not any higher than the general population, but it has caught up to it. They did state that if you take too much insulin, it could relate to a little weight gain, and that insulin pumps, especially automated insulin delivery systems, do cut back on insulin use, and it's usually just right around what everybody else would use for insulin, which could help. But I just think people in general are at risk for obesity in our country, and maybe some of the specifics of hypoglycemia and having to treat with a bunch of sugar snacks over and over again, and things like that might contribute to weight gain.
They also talked about one of the reasons too is people that have hypoglycemia, they feel that they need to eat and keep their blood sugars elevated because they have that fear, and that every time you have an episode of a hypoglycemia, you could be eating like 200 calories or maybe more, depending on the severity of it and how long you feel. It takes like 20 minutes to feel better. You can eat a lot in 20 minutes. And so they're looking at that as also a problem of it.
Yeah, when I work out and I have to have a low snack, I'm like, well, what's the point? I just ran on the treadmill for 10, 15 minutes, and now I just had to eat 30 grams of gummy snacks. Like, there goes
Oh,
my workout. There is this
yes.
complicated, toxic relationship with food that we need it when we don't want it, and we want it when we are high and feel like we shouldn't need
Yeah.
it.
Yeah, and I think a diabetes educator can help you come up with a personalized plan for you. So maybe you bring a banana to your workouts so you can get your potassium in and your nutrition in and some fiber in instead of the little packaged low snacks. That kind of stuff. Like we can make little suggestions, help come up with plans. We can tweak the custom override or the exercise targets, things like that, a pre meal insulin prior to workout. We could adjust those little bolus doses. So we can help you strategize to help you not just have good control, but to live your life with diabetes.
Yes.
And so the whole thing at this show, or this convention, was helping patients to reach their goals, not our goals, which are the time and range, the A1C, but just allow you, to set goals that allow you to live the life that you want. So we need to listen more.
Do offices like the one you work in, do they set goals for you to reach that they're like, well, our patients aren't having enough time and range, like we need to get them up? Like, are there marks that offices want to hit?
Absolutely. And especially if you're affiliated with an HMO or a managed care situation, your hospital system might be getting these grades based on outcomes, blood pressure, A1C, these types of things, cholesterol levels. And diabetes educators help with those statistics, and we help improve the scores of our healthcare systems.
Yeah.
So we improve.
Does that dictate funding? Like the better score you have, the better funding you get? Or what is that? Like, what are the...
I think it could deal with contracts through insurance companies.
Yes. And I know doctors get bonused based on their numbers, but diabetes educators and dietitians, we do not.
No.
Dang, well, I'll start the petition.
But we do a lot of the work to help achieve those goals for the health system. We help reduce the risk of hospitalizations, amputations, hypoglycemia, all kinds of things. We help with A1Cs. So I don't think we get the credit that we deserve, but we're working at it every day.
Yeah, I do think that now with the automated pumps, I do feel like things are going to improve.
But we did hear at the convention that only 30% of type 1s are on automated pumps.
Wow.
This is not acceptable.
Yes, I mean,
it should be the standard of care for every type 1.
Yeah.
So, we're the ones that know this. We're the ones that know how to recommend this, how to train the patient, how to support them in this. So we are really committed to getting the word out and helping people to get onto automated pumps.
Yes.
So it's just, we have a lot of work to do in that area, and spreading the word like you do every day about the benefits of automated insulin delivery systems and how they can rescue you from hypoglycemia while you're sleeping. I mean, the time that you get to sleep at night, that you're not waking up, eating low snacks, freaking your family out. I mean, all these things, it helps with relationships, just your overall, I think, feeling of being a success when you see the numbers that come out of these pumps they're unbelievable. They're as close to a cure as we've come.
Yes. Yeah. And one of the interesting things too is that, back when we were first starting, people were very limited of who could be on the pump. You had to have this and that skills, but now a lot of the research has shown that people that could be out of control being put on a pump, and maybe not one of the high-tech ones, but a lower one that they don't have to do a lot of changing of things, they're doing great. So it's like, we've got to get over us, because we have some biases ourselves, because that's how we were taught. So it's really...
Yeah, we used to make people jump through hoops.
To be on a pump.
To have the privilege of going on an insulin pump.
Yeah.
And it's no longer like that. Yeah. Everyone was type 1 that can do it and should be on it.
Yeah, well, I do want to go back to the GLP-1s because I think that's an important topic. I just last week had someone on the show talking about all the benefits and, how many people with type 1, or at least the inner, conference people, a lot of type 1s are using it there and finding positive results. There's a lot of clinical research going on that we talked about in that, but there are side effects, of course, which we talked about too. But something we didn't cover on that episode, but you mentioned to me, was, the relationship between GLP-1 and disorderly eating, which you briefly discussed. But tell me a little bit more about what you learned about how GLP-1s are already being used, and like how they should be navigated in this area.
So the two ladies that spoke to us were wonderful. One was a psychologist and the other one was a nurse educator, diabetes educator. And they really warned us that, we thought it was going to be like, put everybody on a GLP-1. Yeah. It's really going to, and they really warned us that it can exacerbate some eating disorders. Mm-hmm. So say you're a compulsive overeater, it could help you go all day. So they go all or nothing with their thinking.
There's different types.
So they go all day without eating and then binge at night because they didn't eat all day. Yeah. And the GLP-1 might help them to go all day without eating. So it might worsen a patient with that particular type of eating disorder. Do you see what I'm saying? So it needs to be used with caution in people with eating disorders. Doctors, nurses, dietitians, we can assess for eating disorders. We are not responsible for treating them. These two ladies in their particular eating disorder clinic are, but we can refer out to eating disorder clinics. And if you're going to use a GLP-1, use it with caution in a person with an eating disorder. And I just don't think that assessment for eating disorder is being done. I wasn't aware that 30%.
Yes, 30%.
Especially young women with type 1 diabetes have eating disorders. So this is, a big deal.
And what they talked about too is that, with every meeting you have to reassess, and really make sure that that they're, following, what you need to do. And what I found, people were coming to me that they were taught nothing about their nutrition, nothing. They just like, here you go. And, off you go. And I found it, and I would be looking at their food logs and they were eating like a bar. And I'm like, you can't eat a bar. You have to eat proper nutrition, and you have to eat at least 3 times a day. You have to get adequate protein 3 times a day. Because they had that whole like Ozempic face, like with the like the face, like basically caving in because all the muscles were being used as fuel.
If you're obese and you don't have an eating disorder and you're using a GLP-1, you should see a nurse educator or a dietitian.
Yes.
If you're an eating disorder, you need the endocrinologist, you need frequent follow-up, you need a diabetes educator, and you need a psychologist that specializes in the treatment of eating disorders.
Yes.
But it's up to us to assess whether a person has an eating disorder, and there are some quick little standardized tests that we can do.
You mentioned earlier there was a lot of AI here, so I want to get into that. We've actually covered AI on this show a few weeks ago, this app that takes pictures and tells you more about your food, Snack. And then next week's episode is all about how someone built a feature within DIY Loop that can do similar things, take images and then suggest carbs and tell you all about the food, which is super exciting. I can't wait for that episode to air. You're going to want to see that. So tell me a little bit about, what you learned with AI and how it could transform the landscape on the diabetes educator side.
Yes. So they're showing some of the studies that if you have AI that say, taking information, and then you get like at the end of the session, you're getting like, this is what we talked about. These are your highlights. It is like so much better because that's being taken care of. So you can completely focus in on the person in front of you instead of like typing away, and so that I found that could be very helpful, as well as it decreases the time of the administrative part of
this.
15
minutes.
Yeah.
It can shave off 15 minutes you spend on the keyboard. They say this can be a keyboard liberation.
Yeah, I mean, I myself have been doing that in meetings. Yeah, what now in meetings I just have Gemini do the note taking, and I can really look at the person, see their reactions, because that could inspire questions, right? I'm sure there's educators and endos out there that don't notice someone's reaction because they were busy typing.
Exactly.
Right. So,
Yeah.
it'll make notes for us quicker, help us come up with customized plans for education. So I'm not just handing everybody out the same carb counting handout. I can make one specifically for you and your food preferences, So it helps us become more accurate and more personalized with your treatment plans. So that's nice. And they've done a lot of research on this. And it looks like the AI, when they use it, performs better than the doctors in empathy and thoroughness, completeness, accuracy.
Yeah.
So when patients are studied, and
the AI performs better at empathy than humans. What have we become?
And nurses that used AI to come up with like in these chatbots, like ways to communicate better, were shown to communicate with more empathetic wording and phrases.
Because they're not exhausted trying to keep up with all the note taking and all the documentation. Through where we are, you're accredited by the American Diabetes Association. So, your notes are extensive.
Very extensive, just to be able to bill for my services.
Yeah.
So it takes up a lot of my time. Whereas if I could streamline some of this through AI, it may free me up to see more patients. The problems are, there's a lot of problems with AI, and this is what we all need to be educated on too. There are certain ways to use AI to get more accurate, creative things back to you. Okay. And they went over the different steps for that, but also AI hallucinates.
Yeah.
I don't know if you know about this.
I know that.
But it will make up references. So we have to watch and manage the AI that we're getting. We have to check it. We have to make sure that it's not making things up.
Yeah.
But we did look at a whole bunch of things with AI in this one session.
Yeah.
And we put questions in. We read what it said back. And as a group, we all agreed that it was pretty accurate.
It was pretty accurate. The only thing that they found was
the Mounjaro lady.
That
she put in how to take Mounjaro. And it says you're going to need a pen, and then you're going to screw it on the pen cap. Well, Mounjaro doesn't use the pen needles. Yeah. It uses the auto injector. So it was giving Ozempic instructions for the Mounjaro patient. So, you have to watch what the patient, it's going to require human touch and human review management of these things.
Yeah. So Dexcom just released the ability to take photos within the G7 app and apply that to, your feed of information. Now that's going to go to someone like you, right? Have you used that with patients yet? Or if not, how do you plan to use it with patients? Do you have any understanding of what that's going to be doing?
I'm really excited about that because I just heard about it. So what I do within my practice, I have people just take pictures of their food, and then I have sensor reports that I'm kind of comparing it. But to have Dexcom be able to take a photograph and assess it and then link it to the reports is going to be amazing.
Well, it mostly gives feedback to the patient too, is what I like.
Yeah, at the time.
Dexcom's working really hard on, human factors and making sure that the patient gets the feedback in a meaningful way.
Yes.
So I like that about it. I think a lot of my patients are discouraged that it's not going to do the carb counting for them.
Yeah.
So,
but that's another topic that we learned about.
Use that feature a lot more once it can do that, like Snack does.
Today's episode is sponsored by T1D Exchange. You can directly make an impact on diabetes healthcare, treatments, and technology by participating in the T1D Exchange registry. It starts with a simple survey about your life with T1D, and it only takes about 15 minutes. After that, you'll have a personal portal with ongoing T1D study and survey opportunities. Plus, some of these studies even offer compensation. Signing up with the link in the show notes helps support my channel, and it allows me to continue putting out free content. You can sign up at t1dexchange.org/diabetic or click that link in today's show notes. So you told me that there was this information that came out that carb awareness
Yes.
could be better than carb counting with automated insulin systems. So explain, what is carb awareness and what is the difference between these?
It was really exciting because, I think carb counting is one of the skills that people just kind of like, they don't want to do it. They don't want to look up anything, So what this carb awareness is that you have to be able to identify carbohydrates. You have to have a general idea about how many servings it is, just a general idea. And they're going back to like basic carb counting, not even advanced carb counting, basic carb counting, like not, like an apple 15, even though most apples are 30, but you know what I mean? Like but it goes back to that. And then that's put into the information into the automated pump. And they're finding that, statistically, the carb awareness is doing much better than actual carb counting, which was so fascinating because of the automated pumps. They're able to, kind of bridge the gap that the people are missing maybe in their knowledge base, but it figures it out and it does better.
As a nutritionist and an educator, how are you going to take that information and apply it in your practice?
The biggest thing for me, I always look for quality food, nutrition density. So that would be something that I would continue to do. And then again, looking at their Dexcom or their Libre, like their sensory reports are very important to see patterns and to see like if like every afternoon they're having a snack that that they need to maybe make some adjustments. So those are the things that I'll be working on. But I'm looking for balanced meals. I'm looking for nutrient dense meals. Like people can still have fun food. I'm not against that. But when you're looking at the quality of food that you need day in and day out to be a healthy individual, whether you have diabetes or not, you still need to do it.
If you're carb counting and you're good at it, like Justin,
keep
do
going.
Not stop.
Don't stop.
I'm sorry.
Yeah.
Don't.
But
you can achieve amazing diabetes control, and a lot of people want that accuracy.
One of the doctors said that since the automated pumps are coming out, it was actually the doctor that was talking about his eyes.
Oh, the eye doctor.
He said that since the automated pumps have come out, the trend is now coming down for teenage years.
Oh, yeah.
Because of the automated pumps.
The trend in A1C is coming down because of automated insulin pumps in teenagers. And
that's fantastic.
And this eye doctor was amazing. He uses AI. He works for a company that uses AI to take retinal photographs to screen people because he says only 50% of type 1s go for their retinal screening exams. So if we can catch them in the office and a diabetes educator can take a picture of the eye, you can screen them for retinopathy.
Yeah.
And then which ones need to get in to see him quicker. Yeah. Right?
Yeah.
You'd think they would have that machine in the office. That would be the perfect machine.
Do you know how much it costs? It's $1,400 a month to rent it.
Yeah.
Oh, wow.
So we're not there yet.
Yeah. But again, that's where AI also comes into it because
it's helping every way.
They take the picture. You're either good for another year or there's something kind of going on. You need to now make an appointment with the ophthalmologist. Yeah.
Let's move into tech because I know there were some cool things in the tech area that you saw, like hardware. So let's start with the pivot from Modular Medical. They came on the show. The CEO came on the show a while back to talk about this pump. Since he did, it went from what used to look like a Mobi, where it was a pump that, you could put on your body and then it had a small tube, to now it's tubeless. What did you see with that? What did you learn about this device, this pump?
I I I liked it for probably not type ones, more for type twos, but I do like the concept of it. I like that it's very nicely like flat, so it's a pump that you can wear and it doesn't stick out very much. But I know Mary Rose had some concerns.
I just think of all the things I don't like about
Yeah.
it.
And I think
Yeah.
I'm thinking
She's
like
the positive.
I'm making like I'm just kind of going. I just think it could be good for a lot of type twos. I don't think it's for type ones though.
I like that it holds a lot of insulin.
Yeah.
I think that's helpful.
Was it 400 units, you said?
400 units.
Yeah.
That's great. And 80 hours of use. I don't like that you can't bolus off your phone. I don't like that you can only put in 2 basal segments. And I do not like, number one, that it is not automated. So we have the capacity to automate insulin pumps. So
Yeah.
I don't see the point.
Yeah.
So you
Yeah,
have
I
to
get
change
that.
your Omnipod a little bit sooner if you're on a lot of insulin. It's so easy to just put it
Yeah.
on and you're out the door. So to me, automation is everything.
Yes.
It's changing the landscape of type 1 diabetes.
Yes.
It's as close as we've ever gotten to a cure. Why can't we apply this to type 2s who are desperate
Yes.
for that automated regulation if they overate and they didn't put enough in, or if they even just skipped their bolus, they'll get some insulin.
Yeah.
I'm not convinced just because this is here and you can press buttons that people are going to remember to do it.
Yeah. Yeah.
What about open source presence? I believe you said that there was a talk with someone who uses Trio.
There was, and it was quite incredible that this very conservative organization that we are affiliated with would have some DIY talks. And the woman that did it was on DIY Loop, and she had just gone to Trio. So it was very thorough, but very personal. And she's not a techie. She is now, but the build was hard for her and all this. And she just shared her experience, which was really nice. I thought it was really genuine. And then she shared her knowledge. And so she went through all those little fussy settings that Trio has that all the other pumps don't. So I got a greater understanding of that and a little bit more willingness to assist people. Diabetes educators cannot recommend do-it-yourself systems since we are licensed professionals. But if you choose it, we can help you. Okay? We can't help you build it, but we can help you with the various
once it's built.
things.
Yeah.
Now, Mary Rose, the first thing you said to me on our call before this was that we are closer than ever to a cure. And there were a few cures that you learned about that we have spoken about on prior episodes, the ADA roundup, but there was some new stuff and there's opportunity for people to get involved, right? I know Vertex cured 10 people.
So the Vertex patients, there are 12 of them, they all need to use immunosuppressive drugs to maintain their transplanted islet cells that are working. So 10 of them are completely off of insulin and 2 of them require 70% less insulin than they did before. So it's working, but they have to use immunosuppressive drugs, which can cause other health side effects, right?
Unfortunately,
But they're working very, very hard to come up with membranes and barriers around these cells, and they're moving quickly on this. And there are several different companies making cells and manipulating them to protect them from people with diabetes, type 1 diabetes. Their immune system attacks these cells, right? And that's why you have type 1 diabetes. So we have to protect these new cells we're putting in your body. Now, so they're moving quickly with the Vertex solution, but then also Sana, this other company, just has one patient that they've done a cell transplant with, and that patient was given these camouflage cells, and they're 100% off of insulin. So, but it's only one person, But these two really big scientific executives at Breakthrough are very excited, and they got all of us excited that this is moving fast. They're completely devoted to moving cell therapy forward and coming up with a cure for diabetes. That's what the entire organization's about.
With Sana, so we have cured someone and they're not on immunosuppressants?
One person,
One
yes.
person, yeah.
Wow, well,
It's
I'll take
exciting.
that.
Yeah. So this is the problem with these cells. You've got to take them from many of them from cadavers. You need 3 cadavers for 1 donor. But these newer cells, and there's several companies making these cells, they can use germ cells, so the basic cells, to get them to secrete insulin, and they convert them into islet cells. And these cells are being used with these little genetic twists so that it protects them and camouflages them from your type 1 diabetes immune system, recognizing them as islet cells.
Wow.
So this is so exciting. So they can manufacture more because they're using these germ cells, and they can, change out these little genes to camouflage them. So I think it's very hopeful.
That's incredible.
Yeah.
Yeah.
It's like the first
Incredible.
thing. I know since we've been practicing, it was like in 5 years, in 5 years, in 5 years. We've been
Do you believe it now?
Our whole career.
So I'm not 100% sure
know,
that
but
we'll have 5 years, but you never know.
Yeah, I mean, it's just at least something's working, and that
You
person
found something that works.
Yeah. And you don't have to take it.
And they're actively recruiting patients for both of these options. And the Vertex options should start to get better too, because they're working with the protective, different technologies to protect the cells. So they're actively recruiting. They're only taking people with autonomic hypoglycemia, so people that can't feel their lows and have pretty bad reactions to these severe lows. So you have to qualify, but they are recruiting, and they said to go on their website and to look for clinical studies.
And is this Breakthrough T1D said this to go on their website?
Yes.
Yeah.
I'll put a link to the Breakthrough T1D area of their website where people can look into this stuff. Now, you met patient number 7 of Vertex, didn't you? Cured.
Wasn't 7? Yeah.
You said that.
Well,
yeah.
Yes, I was there. She got her picture taken with these 2 big executives, and I got to, be part of the conversation. It was really exciting. I didn't get a chance to talk to her very much, but the 2 Breakthrough people were just enamored and so thrilled to meet her, because they would never be able to meet a patient. Yeah. It's all confidential and everything. But she was there, and she, thanked them and said she felt blessed. And so, yeah, that was really, really a great moment at the conference there. Yeah.
That's so awesome. Well, thank you both for coming on the show and giving us this update. I'm sad I couldn't make it, but I'm glad that I could at least live through your eyes and your words. So I appreciate it. And I'm gonna try and go next year. I think I would love to go with both of you. That would be fun.
Yeah.
You are definitely a diabetes educator,
yes.
Justin. We're sure of that. And so we'd love for you to come with us next year.
Hang out with us.
Yes. But keep in mind, this video is not medical advice.
No,
Always consult with a physician.
No. It's not medical advice.
Because I'm not a certified educator.
Right.
Yeah. Well, thank you both. It's always great to see both of you. And now that I'm in LA, we'll have to get together more often.
Oh, for sure.
Yes, definitely.
If you are a diabetes educator or work in the industry, let me know your thoughts in the comments with some of the things that they brought up about that side of the industry. How are you implementing AI? I'd love to hear from you. Thank you all for listening. Make sure you sign up for our newsletter with that link in the show notes. Go check out diabetic.info for all your latest news. I'm Justin, and I'll see you next week.